I saw some interesting things.
Yes, orgasms and vibrators.
There you go. All right, now we're going to go back again. Screen share. Okay, from the beginning. Why is it going back to that? It's not, it shouldn't be doing that. Boy, oh boy, oh boy. I jinxed myself, guys. I had it. Okay, so there that is. Start on the first slide. I want to go.
You don't want to hit resume.
Yeah, I want to hit from beginning. And when I hit my beginning, it goes back to that, which is not what I. How about let me just everybody close their eyes and let me advance it to the end, and then we'll start again. There we go. All right, let's try.
I just closed my eyes. I helped make them. So I was like, I just listened to what you said.
I tried to see, it should just show the main thing. So set up from current slide, No. Work. Okay, let's try this.
There we go.
Voila. Okay. Continue.
Okay, you can go to the next slide.
Okay.
We talked about.
Okay.
So this presentation discussion is a compilation of evidence-based literature review, information from professional journals, and subject matter experts. This information is not intended to take the place of advice from a professional provider, and this information is intended to lead guidance in personal conversation regarding these challenges, the nature of professional consultation to seek out to address these challenges, and the empowerment for self-advocacy in meeting these challenges. Time to throw assumptions out the window. Often it is assumed the people who have been treated for the gynecologic, breast cancer, colorectal, and prostate cancer are the people at risk for sexual dysfunction, and they are, for sure. But all people who have been treated for cancer have potential for having sexual dysfunction related to their cancer and or their treatment. And Nicole and I are working on getting the word out there for that. And there is more and more articles and evidence-based literature review pointing to this as well. It used to be when we did literature review, we would see literature review related to prostate cancer for men and gynecologic cancers for women, and breast and colorectal cancer. Now it's pointing much more to cancer treatment in general, and how we need to approach that in general. Next slide.
Okay.
And I'm sure many of you are finding yourself in this boat. Depending on the changes you've experienced in your journey through your treatment or journey to survivorship, you may find yourself needing to change the nature of your intimacy. And different can also be good. Try to open your mind to embrace that different can also be good. And I love this quote from Oscar Wilde. We are all in the gutter, but some of us are looking at the stars.
Mm-hmm.
And I'm hoping that you can find the strength in you to embrace that different can be good. So a huge part, and Wendy, I'm sure you're very familiar with this in your practice, a huge part of sexual dysfunction is entering those difficult conversations because of anxiety, because of the difficulty in articulating what the issue is, because of other people having a problem being comfortable discussing it with you. And so we're going to come up with some tools and tips and tricks in trying to make those conversations, the uncomfortable conversations, more comfortable. So we're starting out with your providers, your physicians, your advanced practice providers, your oncology care team, your gynecologist, your urologist. So I think a lot of you are probably going to chuckle at this. A recent study found that 75% of doctors believe they communicated satisfactorily with those in their care. 21% of those people treated by those doctors said the talks went well. Now imagine this with a topic like intimacy. I'm sure that those numbers were even, the gap was even wider. Next slide. So when approaching seeing your doctor, and this can be your oncologist, it doesn't have to be a gynecologist, it does not have to be a urologist, it can be your oncologist that you're first approaching. It can be Wendy as your counselor, your licensed counselor. When you're first talking about your provider about what is bothering you with sexual dysfunction, and you're considering this conversation, make notes about your issues and be honest and accurate. Research potential solutions. So when you're realizing, when you're sitting down and making notes about what is wrong, what you feel is potentially wrong, and then you start researching potential solutions, think about why those potential solutions are interesting you and why they're interesting you. Then prepare your provider by sending your provider a question ahead of time through the electronic medical record or whatever means you have. With our health network and with UPMC, there's a mechanism that is secure through the electronic health record, which is really nice, especially with a topic like this, to send your provider a note. So there's a couple of reasons why this works really well. First, you're articulating what is wrong, and your conversation will go so much easier because you've already articulated it and you've put thought into it. Second, you're preparing your provider and you're not going to be sideswiping their provider with this surprise conversation. Third, you're coming up with potential solutions and you're putting thought into it already, and your provider may not even know about these potential solutions. And more than likely, most of the physicians I know are going to look up the solutions you've sent them if they're not already familiar with them and research them. So go to your appointment with an open mind and be prepared to listen to what their opinion is about your recommendation, their opinion is about the recommendations or the thoughts you have. And then you can make an educated decision. They may have a specific reason why they might not be a fan of what you came up with. And again, they may not have a good reason, and they may very well agree with some of the suggestions you've come up with, but go with an open mind and to listen. Next slide, please. Bring your partner or an advocate if you're comfortable in doing so to your appointment. Ask questions and take notes during your conversation, and do what you need to do to ensure that you and your provider are on the same page. And by that, I mean repeat back to your provider whenever they're recapping, or ask them to recap your conversation. Repeat back to them what they've said to you to make sure that you're understanding what they are concluding. If after all this you feel like you're still not being listened to, it's time to probably look for somebody else who you're more comfortable with. And that's a quote from Dr. Robert Arnold, a doctor who heads the University of Pittsburgh's Institute for Doctor-Patient Communication. Next slide, please. Does anybody have any questions about that part as far as talking with your provider, having a difficult conversation with your provider, or any experience with that they would like to bring up? Okay. Uncomfortable to comfortable with your partner. And sexual dysfunction is probably one of the most difficult conversations to have with your partner, or to have with a future partner if you currently don't have a partner. And Wendy, I'm sure you can absolutely relate to this with your practice, experience you've had in your practice. Communication with your partner is key towards working together with intimacy challenges. Talking while walking may help alleviate a lot of the tension with an uncomfortable topic. And listening to birds while you're walking can give a nice breather here and there. If you're thinking about it while you're walking down a path through a park or in the woods, sometimes just stopping and listening to the birds can alleviate a lot of that tension, and then you can pick up that conversation. So we're going to enter some tips into making these conversations a little bit more comfortable in addition to our feathered friends. Next slide, please. Prepare yourself. Let's see, I want to see if we can, are the slides covering up the right side of the screen for you guys, or is that just me? Can you see our cardinal on the screen?
Yes, I saw it.
Okay.
Yeah, I did too.
I love the expression on his face. Prepare.
Well,
He's like, Wow,
And
this is an
Goodbye.
interesting
Goodbye.
conversation I'm privy to.
I like Jill. I like that, you know, you talk about the birds and the bees, right? And you have a
Yeah.
birds. I
Goodbye.
kind of like that.
Yep. Nicole brought that up too. She's like, I
I
love how
want to see the
you,
cardinal.
yeah, it's a cardinal.
I want to see it. I don't see it now.
You don't
Here.
see him now?
Well,
No,
it
we're
was on the
past it.
last slide.
Oh, here,
Yeah.
you went back to oh, and I just went forward now. So,
Oh.
oh, I'm going too
There it
forward
is.
again. Yeah, that was, now I'm too forward back again. Yikes. All right. We got it. Oh,
Sorry.
I got to go back. So if I go back, I don't know why it's not letting me to go back to the slides. It continues to go forward, not backwards.
It's okay.
Let me do it this way. Now that's going forward again.
No, you're good. You're good. You were
All right.
on the right one.
I was on the right one? Am I
Yeah,
going
you
backward? Okay. Ah, yeah, I did. So there's the cardinal.
You're going the right way.
There we go. Perfect.
So, yep. Okay, perfect. So, again, prepare yourself, jot down your thoughts before you enter this conversation. And it will help you articulate too what you need to say. And then establish some internal ground rules or make them known. Now, the problem with making internal ground rules known is your partner may suddenly, while your anxiety level is coming down, thinking about the conversation, if you say to them, hey, I need to have a conversation with you and here's some ground rules, can you imagine what's going to happen to their anxiety level? It's going to go way up because they're going to wonder what the hell you're going to be talking to them about. So that's why we're saying, so it's really how you're approaching this. And that's why the internal ground rules is a suggestion. So the internal ground rules are stay the same eye level if possible. But if you're taking a walk, it kind of depends on your height. Avoid yelling. And if you avoid yelling and you haven't shared the ground rules yet, and your partner is noticing you're avoiding yelling, they may very well take a cue from you, or you can say to them while you're talking, I'm not yelling, and we really need to try and have a productive conversation. Maybe if you avoid yelling too, that it might really work, or something along those lines. Wendy might have a good suggestion for that. Avoid accusations and name calling. You are here to solve a problem, and that is not going to help. So all you're going to do is get the other person on a defensive. So avoid accusations and name calling. Avoid finger pointing and laying blame. You are here to move forward from this point. Finger pointing and laying blame is looking backwards. It's not helping to move forward. Also, when your partner is responding, no interrupting. They are thinking about what you have said to them and they are responding to you. And you need to listen, and you need to be a good listener. And so really just listen, because this is a painful conversation for them too, an angstful conversation. Angstful is not a real word, but I've made it a real word. It's an angst-filled conversation for them too. So don't interrupt them. Listen, and listen well, and be a good listener. In describing your concerns and the things you'd like to have happen differently, be as clear as possible and use specific examples. And with something like sexual dysfunction, this is really hard to do. And Nicole has some really good tips coming up to help with that. And boy, that cardinal sure is pretty. Next slide.
Oh, goodness gracious. Okay. Now it's frozen. Was that the next one?
Yep. So after you've listened to your partner, make sure you understand what they have said before you respond. And if you don't understand, ask them. I'm not sure what you mean. Can you explain it to me? Approach the conversation with openness and interest in problem solving rather than needing to be right. Needing to be right can be really detrimental to this type of conversation. You're here to solve a problem. You're here to regain intimacy. And needing to be right is counterintuitive to that. Keep to the topic at hand, except for the birds, and do not walk away or leave the conversation without the other person's agreement. Next slide. Allow for the possibility of timeouts. Take responsibility for feeling the way you do rather than blaming the other person, and drop your assumptions. Assumptions are a really dangerous thing. We've all heard that growing up and through our life, but they are. And so listen with an open mind and don't make assumptions. You are having this conversation to be able to be closer to someone, and you are making yourself more vulnerable, but that may also help you both become more intimate. Remind each other in a respectful and warm manner why you're here. Next slide.
Thanks, Jill. So yes, talking about a problem that you and your partner might be having is really important. It's easier to face it together than to just deny that it's actually there and just further create a barrier between you two. So identify that there's a problem and use those techniques that Jill gave you to help initiate that conversation, because it is a complex problem with couples. Sex isn't always the most important thing, but the actual act of sex isn't the most important thing, but that connection and that intimacy and that relationship is very, very important and very sacred, and you need to maintain that, especially during these times that you're going through. So during treatment, you and your partner went through a really rough experience, a very scary time, and during that, there was a shift in a relationship, whether or not you may have noticed it or not, where a partner can be making sure that you're getting enough rest, helping you with your appointments, seeing if making sure you're eating, helping you prepare your meals. And sometimes a romantic relationship can kind of almost turn into a parent or a caregiver relationship. So once the cancer survivor has been done with treatment and is trying to adjust back to a new sense of normalcy, you have to go back to that romantic relationship, and sometimes that can take a lot of work. And one of the things that you can do is reminisce about your history. So take walks together. You can go to restaurants that you went to in the past, talk about memories, create a storyboard of pictures, look at pictures that you had when you guys first started meeting and that attraction was stronger, and you can kind of spark some of that again to try to get that desire, because one of the biggest things with your sexual dysfunction is loss of libido. So to help with that desire, you can revisit a time when you were creating that foundation. Next slide. Other things you can do to resume your romantic relationship is hold hands instead of just guiding or supporting your partner. Engage in caress instead of supportive hugs. Kiss on the lips rather than just quick little kisses on the cheeks or forehead. Don't just walk away and say, I love you, as it's just like a random, ending. Like, actually mean what you're saying and put a lot of intention into things. Resuming touching can be gradual and allows a couple to once again establish a physical closeness that may or may not include sex. Next slide. During treatment, touch can be an intrusion or an unpleasant sensation. When you're going through treatment and you're getting physical examinations, you're put in a very vulnerable spot and you almost disconnect yourself from your body of what's going on as a coping mechanism. So if there's weight loss or muscle mass loss, sometimes there's an achiness in the body, and just simple touches can be unpleasant sensations. So when you're working on rebuilding your romantic relationship, there are things you can do to help make touch more pleasurable and something that you want. Your partner may also experience a loss of sensitivity to pleasurable sensations because of anxiety, sadness, inadequate nutrition, sleep disturbances, lack of exercise, and fatigue. So those are all basics needs that need to be met. Like, you guys need to make sure you're exercising, eating well, and sleeping well. There is an exercise called finger writing, where you take your partner's palm and you write a 3 to 4 letter word in the palm, and your partner has to really, really pay attention to what is being written to guess what word that you're putting out there. That can help strengthen those sensations for them. Decrease stress to increase any response to desire, touch, and arousal, and deep breathing and mindfulness techniques are very, very helpful. In mindfulness exercise you can do is at night when you're laying down, and this can also help with sleep as well. You can do like a body scan of yourself mentally, and you can clench, like if you're just laying flat, you can clench your toes and hold them for 5 seconds and concentrate on that tightness and then release. And then you can move up from your toes to your calves and contract those muscles, hold them for a few seconds, really feel what's going on, how that feels, and then release, and then move up to your knees, your thighs, and so and go all the way up to your head. Those are some mindfulness techniques you can do. And deep breathing exercises. You can put the palms of your palms or fist against your belly and take deep breaths in and like focus on pushing your hands out with your abdominal muscles to help really get those deep breathing muscles going. Next slide. Reestablishing body self-esteem and relaxation. Again, I said there's a disconnection sometimes during treatment or rejection of your body. One of the things that you can do to help with gentle notices and exploration of your body, getting used to the changes, whether it's scars or different changes going on, is bathing. Bathing is a great opportunity to do that. Use liquid soap instead of a hard bar of soap. Use soft sponges versus a hard washcloth, just to sit there and take notice of your body, how you feel, your sensations, and get used to your new normal. When you get used to things, you learn to adapt better. Next slide. You can change morning and bedtime routines. Something you can do for yourself in the morning is look in the mirror and give yourself positive affirmations. Notice things that you like about yourself, things that you appreciate. Say those things out loud, hear them, believe them. Do this daily, and you start to build your self-confidence back up. Bedtime routines can also change. Get rid of old pajamas, socks, nightgowns, things that remind you of hospitalizations or being at home not feeling well. Throw them out. Get yourself some new PJs or lingerie or something that makes you feel more attractive. You can replace those old clothes with new and bright and pleasing colors made of natural fibers or silks. If you're feeling unattractive, consider what you can do better about your body or your appearance. You can use low lighting or candlelight to help set a mood. There's different lingeries out there for people that have had mastectomies and ostomies out there. There is almost like a flesh-colored fabric band that can go around an ostomy so you can't see it or feel it. That can help. There's different things out there that are available online that you can find to help yourself. Next slide. Reintroducing eroticism. This can be slow and gradual, and masturbation sometimes is the best first step. Body mapping is another way. You and your partner can sit there and use a light marker, and your partner can outline areas in the body that's not normally an erogenous zone, but you can sit there and say what feels good, what feels neutral, and what causes you pain or you don't like, and then that your partner can avoid that area. General massages to the areas that are labeled as neutral, if you do general massage to that area, can kind of heighten your senses to that area and make it more pleasurable to touch. There's also the use of a vibrator, which I'll talk about later. And then there's also, if you pursued behavioral therapy or worked with a couples counselor, they can suggest the sensate focus exercise, where partners take turns touching each other by following certain guidelines, and then they do that practice. There's 4 different stages to it, and the couple can go with their own comfort level. Next slide. Just remember, there's no ultimate goal. Partners should proceed at their own comfort level and go at their own pace, and finding solutions to sexual problems is not always a simple matter. So you may need to seek help from a trained counselor or medical professional. Next slide. Problems with orgasm is another sexual dysfunction that a woman can experience. Jill is going to be talking about the males further at the end of the presentation, but for this, I'm just focusing on females. So problems with orgasms can be caused by nerve damage and or emotional. All women are different in this area before and after cancer, so don't worry about it. Tension and orgasm do not go together. So don't, just try to relax. Don't worry about it. Next slide. Don't fake it to make it, ladies. So if you are having sex and if something's not comfortable, don't fake an orgasm, because that can cause a communication barrier between you and your partner. Honesty is always the best policy, and your partner, he or she, would want to make you happy during this and is looking for your pleasure. So just talk about what you like, what doesn't work, and find something that does work for you. Next slide. Sometimes because of the nerve damage, you may need to use a more intense form of stimulation such as a vibrator, which can be purchased online or an adult novelty store, or any type of a massager found in a drug or department store. Wand massagers, they might be too intense or they might be just right, and they're easy to travel with. At the airport, if they see it in your luggage, they might think that you have back and neck problems, so don't even worry about it. If the wand massager is too intense, you can look for the small battery operated ones. They produce less intense stimulation, but can still do the trick. If the stimulation is too intense, you leave your underwear on as a fabric to kind of protect yourself, so it decreases the intensity of the stimulation. If you feel okay with it, try it alone, just so you can see if it works, what doesn't work for you. It takes pressure off of yourself if you're doing it with a partner, that you can have time to see what you're comfortable with and what you're not. Experiment with different speeds so you can see what works for you. Be prepared and be patient. Make sure you use this with a lubricant to help, and make sure you have privacy so you don't have to worry about anyone walking in on you. Next slide. So painful sex is another complication that women experience. This can be caused from vaginal shortening from pelvic surgery or pelvic radiation, vaginal narrowing from pelvic radiation, or vaginal dryness from hormonal changes or hormonal therapy or pelvic radiation. It could be one or a combination of those three things. Next slide. So what can help with vaginal shortening? If you're experiencing pain during sex because of vaginal shortening, you can change sexual positions to where a woman controls the depth of penetration. A woman can be on top, or side by side can be helpful. Also, that is preferable, helpful positions if you have an ostomy, that you don't have to worry about putting pressure on the appliance or having any leakages, that if you're on top or on the side, that can help with that. Allow extra time for stimulation for arousal. Next slide. Vaginal stenosis or narrowing. The pelvic radiation can cause changes to the lining of the wall of the vagina and actually shrinkage of the vagina itself. So the use of a vaginal dilator will prevent the walls of the vagina from sticking to each other and or scar tissue from forming. This can make intercourse painful and possibly impossible for doctors to do pelvic examinations. The dilation is very, very important. Even if you are no longer sexually active, it's very important that your doctor can do a pelvic examination to check you for any disease recurrence or any problems down the line. Next slide. Vaginal dilation can be achieved either through the use of a dilator or sex. You should do vaginal dilation 3 times a week for 10 minutes, once cleared by your doctor. The narrowing can happen years after treatment, so you should maintain doing vaginal dilation. Your doctor can recommend the size and can provide them to you. At Allegheny Health Network, our radiation oncology department, after a woman's received pelvic radiation, it could have been from a gynae cancer or from colorectal cancer, they would do a pelvic examination and make sure their tissues are okay and healing, and then it's usually about 5 to 6 weeks after radiation therapy, they would prescribe a dilator. You could start small and move up. They have different sizes. Use it with a lubricant. Whenever you get a dilator, so if you get it provided from your doctor, or you can order them online, the ones that we have at the doctors, they're solid and they're white and they work just fine. Or you can get them online, and they can range in different colors and different sizes and different. They can be silicone or latex. So there's all kinds of different dilators out there. What you want to do is when you get the dilator, make sure you wash it with soap and water. If it is a silicone dilator that you got online, there's specialty adult toy cleansers that you can use so it doesn't break down the silicone for the product. Make sure you clean it really good. Use a lubricant. You can lay down on your bed, insert it into your vagina, and just leave it there just for regular dilation for 10 minutes. If it hurts, don't push it through, just leave it there, and then maybe next time you can advance it further, or maybe it might take a couple times before you can advance it further. You may have, when you take it out, clean it, put it in a nice, clean, dry spot. If you've done it for the first time, you may have a little pink tinged discharge from that. That's normal for the first time. You shouldn't have any heavy bleeding or anything. That would not be normal, and you should call your doctor if that should happen. Next slide. Lotions and potions for vaginal dryness. Vaginal moisturizers can be applied 3 to 5 times per week. Vaginal and vulvar moisturizers can be used at any time, not just before or after sexual activity. Use them for 3 to 4 weeks for best results. They could be purchased at any Walmart or pharmacy. They're there. There's a product, I believe it's called Replens, that we've used in the past. I'm not pushing any specific product out there. It's just things that I've seen before that I've gotten feedback that people use that's out there as well. There's other things on the market you can use. If there's anything that would have contain any estrogen, you need to talk to your doctor before using anything like that. But usually those over-the-counter moisturizers that you get do not contain that. Just check on the box. They help relieve routine discomfort from vaginal dryness. Applying moisturizers every few days also helps maintain hydration and pH of your vagina. And moisturizers can also help with friction issues during intercourse. So you still need to use a lubricant when you're having sex. Next slide. Again, discuss with your oncologist prior to using any estrogen products, such as an estrogen cream, pill, or ring. Next slide. Different types of lubricants out there. Jelly lubricants, such as KY jelly, they can dry out quickly and may feel sticky and uncomfortable to use. Water-based glycerin lubricants work well for vaginal dryness, and they do not get sticky after prolonged use. It's very important if you're using a latex condom, you use only water-based, because silicone will break down that latex condom and put you at risk for pregnancy or infection. So only water-based if you're using latex. Avoid any warming, scented, flavored, or oil-based lubricants because they're irritating to the vagina and can cause a yeast infection. Next slide. Silicone lubricants last a long time. They're not absorbed by the skin, so they're very useful as well. Residue needs cleaned off with soap and water because they are not absorbed. Caution if you're using in the bathroom or in a shower, because it will make the surfaces slippy. It will cause deterioration of a sex toy or silicone dilator. Next slide. Other things that you can use for vaginal dryness is vitamin E oil, olive oil, coconut oil, or cocoa butter. Avoid clear mineral oil because it often contains petroleum, and don't use Vaseline because those products are irritating to vaginal tissue. Next slide. Okay. Jill's going to talk about pelvic floor rehab now.
Yep. So Pittsburgh's major healthcare systems, both AHN and UPMC, have pelvic floor rehabilitation. And that's a phenomenal program that not a whole lot of people know about, that makes phenomenal changes for women and for men. Recent research has suggested the importance of synergy between the abdominal muscles and the pelvic floor muscles. Using abdominal muscles to initiate tonic floor pelvic muscle activity, monitoring biofeedback, patients are made aware of contractions and incorporate pelvic floor muscles into their daily activities. In a Korean study, participants in pelvic floor training programs showed significant improvements in their sexual functioning scores. So sexually active women increased, I can't see with the pictures here, 41 to, it's like 75%. And the non-PFMT group increased in their sexual function scores from 39 to 43%. So it made a huge difference for them to go for pelvic floor rehabilitation in terms of all around sense of well-being and sense of sexual function to go for pelvic floor therapy. Next slide, please. The other benefits of pelvic floor therapy are tremendous in that they help women and men with fecal incontinence issues and with urinary incontinence issues, which can help with your overall sense of well-being and your sense of confidence. They also increase circulation for your sense of arousal. So our oncology rehabilitation department and our rehabilitation services department has pelvic floor therapy, and UPMC also has it. Next slide, please. Some words on men's sexual health issues after cancer treatment. Everybody is aware with prostate treatment, oftentimes there's erectile dysfunction, and with the hormone deprivation therapy. The other thing that can happen also is it can happen with other types of cancer treatment. Sometimes men have issues with ejaculating urine rather than semen, dry orgasms, loss of sensation, pain in the testicles or penis with sex, and body changes related to surgical cancer, surgical intervention for cancer. And gentlemen, you are not alone. There are a host of interventions available to you for any of these. And many of them are multi-modality interventions. Next slide, please. Pelvic floor therapy is becoming more and more common for men, and I hope that any men that are having issues consider going to pelvic floor therapy and seeing if they can be helped. They do pelvic floor therapy often helps relieve urinary and bowel incontinence issues and does help alleviate erectile dysfunction when we're also working with a urologist. And Wendy, I do have to say I need to include licensed counselor here in addition to psychologist. Various physical treatment modalities for erectile dysfunction are vacuum devices, injections directly into the penis, prostheses that are used or inserted surgically, medication, meditation and relaxation techniques, therapy and communication skills, pelvic floor therapy and Kegel exercises. More and more evidence-based practice is suggesting that multimodality treatment works best where you take meditation, relaxation techniques, and the physical techniques that a urologist would treat you with and combine them for to obtain optimal results for erectile dysfunction, oftentimes obtaining optimal results, and also that helps with the relationship issues as well. And also working on the relationship itself in addition to the meditation and relaxation techniques. Next slide, please. Other symptoms of discomfort, which we spoke of, you would work with your urologist and also consider having a psychologist or licensed counselor, such as Wendy, on board on your team, such as ejaculating urine rather than semen, dry orgasms, loss of sensation, and pain with sex. Because these can be anxiety provoking, and that really interferes with the whole intimacy spectrum. So if you have these two people on your team, you can really tackle a lot, hopefully tackle a lot of the issues, and work with your partner on resolving some, if not entirely, a lot of the issues that you're having with intimacy. And if you can't entirely resolve them, you can, as we were talking about before, you can have a different approach that is still really wonderful and very satisfactory to you and your partner. Next slide, please. There's a lot of mind over matter with discomfort and pain, which I think Wendy can help us attest to when we're done with our presentation. Partial or full panectomy, which is sometimes part of surgical intervention. An erection is possible with a partial panectomy. Full panectomy, no. But again, different can be wonderful, and it doesn't mean that intimacy isn't possible. And please consider working with a psychologist, a licensed counselor familiar with men's sexual dysfunction issues, and with your partner in both of these situations to gain as full and as wonderful as a survivorship. You've gone through a lot to get to this point, so give yourself that gift of having a satisfying relationship, because it is possible. Next slide, please. So a few words on sexual safety with long-term anti-cancer therapy. In a lot of the, in some, I'm sorry, not a lot. There are 2 studies out there, and these are the only studies that we were able to find in tons and tons of literature review, and I think it's because the pharmaceutical companies decided not to pursue this further. Chemotherapeutic agents were found in semen for up to 7 days after the last dose of chemotherapy. So consider using a condom, gentlemen, to reduce exposure, potential exposure of your partner to that chemotherapeutic agent, regardless of the need for contraception. Consider using a condom for up to 7 days after your last dose of chemotherapy. So that also means if you have a male as a partner, consider using a condom. Abnormalities have been noted in sperm for up to 2 years after the last dose of chemotherapy. And this is if you're in a relationship where your partner may become pregnant. Be aware of that. A lot of literature says that you cycle through your sperm in 6 months, but there are several studies that showed that abnormalities do occur for up to 2 years in the sperm. So just be aware of that. Follow your oncologist provider instructions with regard to contraception, and with any possibility you may become pregnant or your partner may become pregnant and you're sexually active while being treated. At any point while trying to achieve intimacy, listen to your body. If something hurts with intimacy, see your doctor or provider. Your body's trying to communicate with you. Next slide, please.
Well, thank you all for your time. Is there any questions or comments? We're still working on improving our resources that we have out there for patients that are suffering from sexual dysfunction. And we'd like to hear from you guys about what you feel is something that we can take back to the table and take in consideration when we move these programs forward.
So we're going to ask questions, guys, by the chat on the side. So if everybody can do that, on the bottom of your screen, you'll see if you take your scroll down, it says chat. And if you click on chat, you should be able to go over and then type in your questions. So I think there's some things over there. So if anybody has questions. I know there's a lot of people that are kind of muted out. So anybody have questions they want to type over there? I know this is a hard subject to talk about.
Yeah, we also provided our email addresses there. If you don't feel comfortable putting it, it's on the last slide. And I can type it into
Type
the
them in chat.
Yeah, if you could type them into the chat, that way everybody can.
if you feel more comfortable, or maybe it just didn't come to you yet, and then you can ask us. We
Right.
may have an answer for you. If not, we can find one for you.
Yeah, the other thing, if you just go into chat and you type to just me, or you type directly to Nicole or Jill, we will just see that question. We won't tell anybody who it's from. That way we won't embarrass anybody, right? So if you have a question and you just want to hit, it says to that person, you can just type it to me and I'll only see it on my screen, and then I can ask the question. I won't identify who it's from, if that makes sense to you guys. I know I have a question for the ladies. So one of the lubricants, questions people have asked me about using baby oil. Is that something that is is that an acceptable lubricant, baby oil?
That was not one of the safe products that I've come across when I read it. It was coconut oil, cocoa butter, vitamin E oil as things that you can use for the tissues. Baby oil. You can use baby oil for massage. When I was reading about the Sensate exercises, they said that you can use baby oil during the first 2 stages where you're just massaging regular body parts